Hi, I'm Dr. Alberton. I'm a thoracic surgeon here at Logan Health. So there's two main types of lung cancer. There's what's called a small cell lung cancer, which is usually or more aggressive, I would say. And those usually don't get surgery. They might require surgery if they're detected very early. And that is what's called non-small cell lung cancer. And the two main types of non-small cell lung cancer is which is called adenocarcinoma and squamous cell carcinoma. There's also neuroendocrine tumors or other types of cancer, but the non-small cell lung cancer is a type of lung cancer that usually, if detected early, can undergo surgery with the intent of cure. So in order to decide if the patient is a good candidate for lung resection, there is few things we use. The most important is the performance status. That means, is the patient able to perform physical activities? Do they live independently? Do they require any oxygen supplementation or not? In addition, most of our patients would get what's called a pulmonary function test, and that's where we can quantify the volume of how much air is going to the lungs. And there is other more advanced studies such as a ventilation perfusion test or a MVO2 testing, which is the consumption of oxygen. We can use those in selected patients. The recovery process for lung cancer surgery varies from patient to patient. Obviously, the goal of surgery is to take the cancer out, but most important is to get the patients back to their baseline. Most patients will spend about 1 to 2 days in the hospital. It can be as early as a day, as long as a week. In terms of going back to baseline, usually is about 1 to 2 weeks, however varies from patient to patient. So technology has advanced quite a bit in the last few years. Recently we have the introduction which is called robotic surgery. So robotic surgery allows us to do the same operations as used to be done traditionally open. However, now we can perform the same operation with little incisions. So that will fasten the recovery time of patients. There is less complications and now less blood transfusions, infection, and faster recovery. Since we have the newest technology, which allow us to perform most of our surgeries minimally invasive, the recovery time of the patients are much faster. So that has two big advantages. One, they can go back to their normal life faster. And as important, if the patients require any kind of chemotherapy or radiation or additional treatments, the faster they recover, the faster they can transition to get what's called adjuvant treatment and carry on with their treatments after the surgery. In terms of the surgical care that we can deliver here in Kalispell, we are very proud to say that we have the newest technology. In terms of diagnosis, we can use the ION system to diagnose lung cancer early. And in terms of the robotic capabilities to perform lung resection, we can actually deliver the same level of care here at Logan Health as you could receive anywhere else in the country.